All right, great. And we are here today with another very special guest helping us with our COVID-19 um, conversation, Dr. David Liepert, who is an anesthesiologist and a healthcare worker in Calgary, Alberta. Dr. Liepert joins us today. A little bit of a time lag, but that's okay. And we will be talking all things sort of your big focus as you work in the hospitals. So we'd love to get that perspective. And as a frontline healthcare worker, I'll turn it over to you, Dr. Liepert, to just give us a little bit more background about yourself versus me trying to talk about all the wonderful things you've done in your career. I think it's better if people hear it directly from you.
Yeah. Well, thank you so much for having me on your show, Dr. Lou. It's
My
just,
pleasure.
I think the more information we can get out and the better information we can get out, the better we're going to deal with all of this, because information management is the issue. I'm an anesthesiologist, as you said. I'm also a Stanford trained intensivist, trained in critical care medicine. And I also have special training in the way we use data to do quality assurance and quality improvement in medicine. And that's really the credential and the skill that I'm bringing to the DNA company and My Next Health, which are the collaboration that we're undertaking with Alberta Health Services and the Government of Canada and IBM as well to help us all deal better with the information that we have both inside us and coming into us in the context of this COVID crisis.
Great. And so you are working in a critical care capacity right now in the hospitals in Calgary, is that right?
At the moment, they haven't deployed me into the ICUs because in my hospital's ICU, we've got 17 beds available. We've only got 2 COVID patients in those beds right now. Alberta has done an amazing job. It's just,
Yeah.
I know Premier Kenney was on the news the other day talking about beginning to share some of our resources with the rest of you because Alberta Health Services is so well organized. And
Yeah.
we're just bringing that organization to all of this.
And what do you think's been that difference in terms of your opinion? Like why is Alberta doing such a great job and other provinces maybe are not? I mean, a lot of it probably just has to do with location and where people travel to and things like that. But is there anything else that you can think of that is sort of a difference maker?
You know, it's the way we're coordinating our response. Everyone is talking about COVID crisis and particularly the lethal consequences of COVID, because we know that there's 50% of people who are asymptomatic. We know that of the 50% of people who have symptoms, 80% of the people who have symptoms just have a really, really bad flu. And then there's the 10% of people who can die from this because of either pre-existing health disease or something else. And people talk about a cytokine storm. Now, what you need to know about cytokines are they're just what our body's cells use to communicate with each other and to coordinate, particularly how we manage external threats. And so we've got this massive cytokine storm inside some of us that's taking some of us down. We've got the same cytokine storm going on around us too. Outside of us, we've all got overwhelming amounts of information coming in. We're having a lot of difficulty dealing with prioritizing the information that comes in. We're having an even more difficult time prioritizing our response. One of the great strengths that AHS brings to this is they are extremely well organized around and across the entire province just to deal with information and coordinating our response.
Yeah, and I think that's a great point. I've said before on my show on radio on Global News that I think a lot of what we're going through, a lot of the help is really going to come down to knowledge, right? Knowledge seems to be maybe the miracle that we all need right now. And the more that we understand about this, the more we can all do our part. And I think it's great that the province of Alberta has such a great coordinated response. And I believe that you guys have done a great job. One of the things that you brought up when we started, you were saying that out of the, I believe it was 17 ICU beds that you have at the hospital where you have only 2 COVID patients. My understanding, and even here in Ontario and some of the emergency room physicians that I've spoken to, they've sort of said to me, it's never been quieter, right? They've never had such little work to be doing, I guess, because a lot of this was an idea to ramp up for something. Maybe it's either not here yet or it may not happen, which thankfully that's a good thing. That's not a bad thing. But hospitals seem to be quiet here in Ontario. And I think you're alluding that that's the same thing in Alberta.
Well, and the big terror from COVID is that when this started, I don't know if you recall, they were talking about we can expect a 40 to 70% infection rate.
Yeah.
At the moment, I think we're getting up to about 1% of us have been infected with this. But that means we've still got the vast majority of patients who are still going to be exposed to COVID and respond to COVID. And we still don't know how to deal with that. And one of the reasons why we created My Next Health and why the DNA company has begun doing what we're doing is not just to help us deal with the information going forward, but also to help us deal with the fact that we can improve our baseline health. We can improve the way we deal with all threats and all stresses so that we can coordinate, again, internally and externally with our information a lot better.
Yeah, and that's an interesting thing. And when you graciously were on our show live on Global News, we talked a lot about this in terms of the importance of basal health. And I've been speaking with a lot of people around this topic, and it's something that I'm passionate about anyways with what I do and with what my company does and my role as a healthcare professional. But there seems to be, I think this might be, I don't want to say an awakening, but I think it does bring to light the importance of people doing the self-care that's required, right? I mean, as a chiropractor, one of the big things that we deal with is musculoskeletal pain, obviously, and low back pain being the vast majority of that. And we know with chronic low back pain that really the cure, I'll use that term, even though it's not really a cure, but the best management that we have towards it is the person doing self-care in terms of rehabilitating their low back, the muscles of their core, keeping healthy, reassurance, all of those things. But that seems to be the case even with COVID-19. I mean, a lot of the risk factors that we're seeing for the serious cases are lifestyle things that lead to hypertension, potentially diabetes, obesity. And now, I guess to some extent, we as healthcare professionals, we can both accept that there are some genetic predispositions that no matter what you do, some people will be more genetically predisposed to hypertension, diabetes, all those things. But a lot of it is lifestyle, and a lot of it does come down to that basal health that you and I understand so well. Can you just share with the listeners what we mean about that and a little bit dive deeper into that?
Well, yeah, we've been invited, actually, the DNA company and Dr. Mansour and my data management a little bit too. We've been invited today to participate in the big Alberta Health Services study of whether or not Plaquenil is effective. One of the issues with Plaquenil in COVID is people still don't know how it works yet. It is a drug that kills malaria. Malaria has nothing to do with COVID. Okay. It's a drug that's good for rheumatoid arthritis. Rheumatoid arthritis probably doesn't have a lot to do with COVID. One of the interesting side effects of Plaquenil is it actually drops your blood sugar. It actually helps you manage your type 2 diabetes. And that brings us to when Dr. Mansour and I started collaborating on basal health, we were actually in the pain space. We were dealing with all of the data that he's actually collected, looking at the relationship between chronic pain, which including low back pain, but linking chronic pain to chronic metabolic inflammation. That's right. Now, there's all kinds of genetic markers that put you at risk for metabolic inflammation. You can have disorders in the way your body deals with methylation. You can have different genetic predispositions to difficulty with your mitochondrial redox reactions. You can have difficulty dealing with detoxification and the glutathione pathway. All of those things contribute to pain, metabolic inflammation. It looks like those are the same things that are contributing to the people who are dying from COVID. A really great paper came out in Nature just about 1 week ago. Science is moving very, very quickly in this space, but they are looking at the data linking hypertension and diabetes and COVID. Our information through the DNA company actually links that to metabolic inflammation and the risk of having endothelial dysfunction and all of the things that are contributing to taking us down. We're talking with AHS about bringing that data so that not only can we use the information to improve identifying people who may be at more risk from COVID, but also to identify people who will respond better to drugs like Plaquenil, and also to figure out why Plaquenil works, because there may be better choices than Plaquenil.
Yeah, and I think that's an important point that you bring up there. One of the things, and I sort of want to clarify a little bit further, because again, as healthcare professionals, I appreciate what you're saying, but I know the average listener may have heard a lot of what you said there, which was great information. And I can imagine that what they'll get out of that is that if I have chronic pain, I'm more at risk. Can you just speak a little bit more to that? Because I don't think that's necessarily the link you're trying to make, or at the very least, we don't understand yet. Maybe there is something unique about certain people from a metabolic inflammatory perspective with chronic pain that may be also linked to people getting serious illness through COVID-19. But I just want to make sure that people aren't sitting there thinking, well, I've got this chronic shoulder pain. Does that mean I'm going to, die from COVID? And I want to make sure that we clarify that.
Well, because at this point, there are so many things we don't know, and we're all worried about whether or not we're in the group that's going to be at more risk. And that's actually why the DNA company and IBM are collaborating on this My Next Health platform. We're developing a rather extensive questionnaire, but it's a questionnaire that actually allows you to focus down on the simple things that you can do. Like, rather than just sitting in fear of COVID, you can change the way you eat a little bit. You can improve your dietary supplements a little bit. You can take things as simple as N-acetylcysteine. We talked about this on Saturday. Yeah. N-acetylcysteine and vitamin C help your lungs deal with oxidative stress. There's already a lot of data for people who just have the flu that actually being on things like N-acetylcysteine and vitamin C do reduce your risk of pulmonary complications, even just from the flu. Yeah. But if there is, in fact, a specific linkage, as it appears there is, between COVID, metabolic inflammation, these genetic vulnerabilities, and the things that we can do about it, the app that we're developing with My Next Health and IBM is designed to help people deal with that information in an actionable fashion.
Yeah, and I think that's a great point, that people and that goes back to what we were talking about in terms of taking a little bit more onus on what's going on. Because I think one of the dangerous things, in my opinion, that we've done is we've asked people to isolate at home. And again, the average person is probably sitting at home, not getting much exercise. And I've heard this on the news, and I'm sure you have, the COVID-15, where the idea is that people are gaining weight because they're probably lack of exercise, poor food choices. I mean, when people are raiding the grocery stores, they're raiding the grocery stores for highly processed foods, things that can last a long time. And those things often have a lot of preservatives in them, are carb heavy. And that sort of ties into that aspect of hypertension and type 2 diabetes. And there is research that, 2 or 3 weeks of some bad lifestyle choices. Now, you're not necessarily going to develop diabetes, but you do start to develop maybe a little bit of insulin resistance, maybe your blood pressure can definitely change in that time. And I think there hasn't been this focus on healthy social isolation, making the right choices, probably more importantly now than ever. We would want to be spreading that message. Do you agree with that?
Oh, absolutely. Like, one of the big issues is just going to be our vitamin D3 levels.
Yeah.
Because we need sunlight to process our vitamin D. And our vitamin D is so important, not just for our immune function, but also for our mood function. Yeah. We're all afraid, and we're all depressed, and we're all at risk of seasonal affective disorder in a much more extended fashion because we're not getting out into the springtime because we're socially isolating. And one of the difficulties with medicine and the way we deal with information in medicine is we have this concept that there can be a cure for every disease. We have a very interventional model for how we deal with healthcare. And the other issue that we have is we think that what works for one person should probably work for the person right next to them. And even looking at genomics, most of the genomics work that people are doing is to identify who will fit better into the studies to prove that the drug works, rather than identifying which drugs or compounds are actually going to work better for you. Yeah. So what we need in a situation like this is we need an interventional approach to improving just our basal health. even if we don't know what to do, if we make ourselves healthier, we get our vitamin D3 levels better, we exercise more, we eat better, we take appropriate nutritional support and appropriate supplements, we get our metabolic inflammation down to a minimum, we get our blood sugars under good control. All of those things contribute to our general level of health being better, so that whatever the stress that we're facing, COVID or a broken ankle because we went out through our front door and didn't realize we hadn't shoveled our walk, all of those stresses, the more we can respond to those stresses in an efficient, appropriate, and coordinated fashion, the better we're going to get through all of this. But vitamin D3 is one of the big things because it's immune function and it's our mood support.
Yeah. Yeah, and you're absolutely right. And I guess for the listeners who don't sort of know what a seasonal affect disorder is, it's a period of time throughout the year where, you know, especially here in northern climates like Canada, we're more prone to it because we have less exposure to sunlight, and there's some link with that, with depression and anxiety and other things. And so, and a big part of that is vitamin D, which our main source of that is sunlight. And people don't realize that this isn't something that is readily available in very many foods that we eat. It really is about being outside and being the, and, you know, I correct me if I'm wrong, from what I remember, is the majority of that intake of vitamin D actually happens around the eyes, more so than other areas. Is that right?
You may know more about that than I do, because it's
Okay.
just, I know that ultraviolet light drives the conversion.
Yeah.
But the metabolism, it would make sense because our eyes have a lot less melanin. It's like you and I'm
Yeah.
looking at you. We both have a lot more tanning on our cheeks than we do around our
Yeah.
eyelids.
Yeah.
And it doesn't take a lot of sun exposure, but it takes some sun exposure.
Yeah. And especially in a lot of climates right now in Canada, it's still cold and bad weather, and people don't want to be outside. And so, yeah, it's an interesting thing. And so is that something that you recommend? Because so another thing that I've been critical about, because it's a passion of mine, is falsehoods. Like when people start spreading myths about anything, it bothers me, right? It would bother me in general about anything. I'm very much an evidence-based practitioner. I think we should heavily rely on science to make good informed decisions on how we take care of ourselves, how we take care of our patients. And I've seen some horrible things on social media that I've used my platform to dispel. But, and I guess a lot of it, it's the natural stuff that a lot of the times gets the bad reputation, right? Because, but vitamin D, is that something that you think that the average person should be taking right now? And do you think that potentially would help? I mean, I don't think it's going to help, you know, necessarily. I don't know. I'll turn it to you in terms of prevention or treatment or anything like that.
One of the things that in the system that we're building, one of the most important parts of it is the genomic assessment. And we have people go through questions. And if you're already on vitamin D3, we're of course not going to be recommending that you take more of a D3, but we are recommending that everyone be on a maximum of 2,000 international units of D3 a day, because that's absolutely foundational.
Yeah.
But it really speaks to one of the most important parts of how we're going to respond to this COVID crisis, because self-management is going to play such a major role. We know our healthcare resources right now are completely focused on COVID and emergencies. And that's an understandable response because everyone is afraid of being overwhelmed systemically. We're also afraid of being overwhelmed internally. Yeah. We can't really affect the system except if we improve our own ability to not be overwhelmed internally. We contribute to everything functioning better. And self-management of information in a way that is well adjudicated, facilitated into safe pathways, so you don't end up doing the stupid, dangerous things. I've seen stuff on the internet, you've seen it too. There were people drinking bleach because they were concerned about acidosis, which that'll kill you.
Much quicker than COVID.
When I was an intensivist running ICUs, if someone drank bleach, it's like they would die. There was virtually nothing that we could do. So we need to be focused on safe, effective therapies. I'm chief medical officer of the DNA company and of My Next Health.
Yeah.
And my big focus is quality and safety, quality of the information and safety of the recommendations.
Yeah. Yeah, and I think that's really important. And I think when people take these things out of context, there was, I forget if it was in Arizona where you heard about when a lot of the anti-malaria drugs are being spoken of. Someone in Arizona took some fishbowl cleaner that has a bit of a derivative of the chloroquine, and they ended up dying. And it's like, what are people thinking? Like you should not ever be self-medicating for anything. That's very, very dangerous. And I think anybody that speaks about these medications or anything that may potentially be helpful, I mean, and I think you would all agree, any healthcare professional, run it by your healthcare team. There's nothing wrong with having a conversation about these things. And I guess when we turn it to something like vitamin D3, I mean, there's really no negative health consequence to having 2,000 IUs of vitamin D. So I think overall it's pretty safe. Are there any contraindications that you can think of or precautions that people should take if they're considering vitamin D? Or there certain instances where maybe it might not be a good idea?
Well, you can certainly overdose on vitamins too. And
Yes.
the fat-soluble vitamins, A, E, D, and K, are
Yep.
ones you actually have to be careful not to exceed the maximum doses.
That's right.
A lot of it comes down to, though, just common sense.
Yeah.
And speaking of, like you were mentioning natural drugs and things of that sort. One of the things that I love about anesthesia, we're all just one generation away from tribal shamans. A lot of our drugs are barely purified from the original things that were originally being used in our original cultures for like 6,000 years.
Right.
And we also do something called surfing the side effects. Like I'll use a drug like atropine to counteract the effect of another drug that I'm giving to bring your muscle strength back. But when I use atropine, I'm choosing to do it because it also has a side effect of reducing your nausea, because it kind of has a bit of a similarity to the way Benadryl or Gravol works. And so we have a certain familiarity with the way the side effects of the different compounds can be used in a positive fashion too. And like, for instance, Plaquenil. Plaquenil is hydroxychloroquine. It's related to quinidine, which is derived from quinine, which comes from cinchona root. Cinchona root was kind of a South American thing that came into Western medicine through the Jesuit priesthood. They discovered that it was effective for malaria. Because it entered through Europe, it's always been there. It's not surprising that it's one of the first go-tos that Western medicine went when they were looking at ways to modify the immune response, because we have a certain familiarity with it. But it's also been very heavily processed. And like Plaquenil is capable of dropping your blood sugar to a greater extent than is absolutely safe. There are other drugs in our compendium of natural therapies, things like black cumin, that shares a very similar group of actions with cinchona root, like thunder god vine in China. Although thunder god vine has to be prepared very, 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 very carefully so that it's non-toxic. All of these different agents and therapies, I would not be surprised if there isn't a genomics focused reason to explain why some things work better in some people than they work in other people. Because we've had these compounds, we've been dealing with pain, we've been dealing with metabolic inflammation, we've been dealing with type 2 diabetes even before we knew that there was type 2 diabetes. We've been dealing with pandemics. Our cultures have historically been dealing with these issues for thousands of years. And so we actually have this vast reservoir of natural wisdom that we will be bringing to bear in how we deal with this crisis, other crises. And I think one of the most important lessons we're going to get out of the current COVID crisis is we need to listen to each other more. We need to be positive cytokines societally rather than negative cytokines. We need to make sure the information is good, but we also need to make sure the information is shared so we can all benefit from it.
Yeah, and I think that's great to hear from a physician, right? Because so much of, myself on the chiropractic side, and I'm very much a scientifically based practitioner. And a lot of my team, I have the opportunity to work with physicians, allied health, all different types of professionals, which is an absolute pleasure for me. And I really do that because I believe we all bring something to the table, right? There, in 2020, with the wealth of information that we have, it's impossible for any one professional to know everything. And I think if we can all work together to bring the strengths that each individual profession can bring to the table, I think that's really how we move forward, like you said, not just with COVID-19, but with so many other things from a health perspective that affect us every single day and create all kinds of burdens. And I think that's it's really refreshing to see that so many more healthcare professionals are moving that way to really look at the benefits. And I think what you bring up with genomics is sort of the future too, right? Where the idea of understanding individuals versus just making sort of a one fit for everybody. And really when you can understand what is unique to you and how certain things might interact with you specifically, I think that's really the next level of healthcare in terms of what we can do better.
And it all comes from listening to each other. I trained in Saskatchewan under an orthopedic surgeon called Dr. Kirkcaldy Willis. And he was actually he integrated chiropractic with orthopedic surgery at a foundational level.
Yeah.
And so this idea that there was ever a conflict between traditional orthopedic surgery and traditional chiropractic is completely foreign to me, because everybody has the same goal and works towards the same purpose using the tools that they have to bring to bear. Yeah. And that kind of speaks to a large extent how we deal with information management in medicine, and why we built this system and why we're building this system with IBM, but yet working to integrate it with Alberta Health Services and working to integrate it with Health Canada. Like we actually have a Health Canada Class 1 approval for our system, yeah. And we're working with the FDA to get that approval as well, because you can use information to help make yourself better as long as the information is good and safe.
Yes.
You can use information to help make the entire system better as long as the information is good and safe. It pertains to the questions that you're asking. If you're asking the right questions, you're going to find the right answers. But the one thing you don't want to do is just refuse to ask a question that could actually help make you get better. Admit you don't know things, ask the important questions, get the information, and act on it. So many of our recommendations, for instance, in the app, I sorry for keeping on dragging it back to the app. No,
that's okay.
I'm really excited about this. A lot of our recommendations are just fundamental foundational vitamin D3, yeah. Good choice of B vitamins, good dietary choices, exercise. All of those things pertain again to our basal health level. One of the issues that we really find dealing with people who trust the Western medicine approach, where if there's something wrong, you take a pill, you get better. So many people don't know that the way they feel is not as good as they could possibly feel. I had a nurse talking with me a couple of days ago. She went through a functional genomics assessment. She got some advice about the things that she should eat, the vitamins she should take. She got some advice about her gut biome as well. She feels good now to the extent that she says, I didn't know that the way I felt before wasn't good. I thought that was just normal. Yeah. If we start digging into this, if we start getting good information, not only will it help us deal better with things like COVID, it'll help us deal better with all of the stresses. It'll help us just deal with the stresses of life so that we will be better individually, but also less likely to use the system.
Yeah, and I think that's a brilliant point, right? Where you've got, I always say there's this spectrum of people who are, only want that Western type of approach of either give me a pill or cut me open somehow. And then you've also got the other end, which is equally dangerous, where there's some health freaks that don't ever, if their kid gets meningitis, they don't want them on antibiotics. They don't want to vaccinate them. And I think it's like anything really in the world, right? Extremism is always the problem. But when you could take everything and find the moderate aspect of it, when you can come to the middle and see where the benefits lie on both sides, that's really where potentially the optimal ranges, right? And I think medicine and healthcare is no different. When we can look at this and say, okay, well, where does that Western approach play its role, and where does the more alternative, complementary side of things play its approach, and how can we bring it together to really find the optimal aspect? And I think that's such a brilliant point, again, that's really the importance. It's something that I'm passionate about also sharing with my audience, with my patients, that I think we need to do that. We need to really find a way to move that way, because I think it's beneficial for everything.
Well, it just, again, it speaks to the whole information as cytokines approach. That yes, we're dealing with this internal cytokine storm. We're terrified about our bodies not dealing with information well and starting to attack ourselves, and the incredible impact that can have if we're using the information that we have societally, externally, and we're not coordinating it well, and we're not dealing with it well, and we're not listening. Like, one of the great things I love about dinner conversations, you have to shut up to chew. So exactly. If we actually listen to people and realize we're all on the same side, like people have been using COVID information to attack Donald Trump. People have been using COVID information to attack Hillary Clinton. There's no purpose to either of those things. No. We need to work together. We don't need to attack anything other than the consequences of COVID. And we need to coordinate that information. We need to work together. We need to realize we're actually all on the same side. We may have different approaches. Sometimes we might be right. Sometimes we might be wrong. The only way you'll find out if you're wrong is by listening to people who, in that context, may know a little bit more than you do, or by asking the right questions.
Yeah, and I think you're right. We're all on the same side here, and we all need to be, like you said, asking the right questions to get to the right answers. What are some things that again, going back to, we both understand that everything can play a role, but is there anything that you've heard which is it's absolute BS? Like, the one thing that I can think of, and Dr. Mansour actually brought this up, and I totally agree, is this idea that COVID is really symptoms from 5G towers. Like, that's just absolute BS, right? Like, there's no potential. Viruses are real. Like, this is not something that's being made up. Is there anything else that you've heard that sort of is like, no, don't ever sort of fall for that or listen to that type of nonsense?
Well, we already mentioned one of the things, like bleach drinking, that will kill you immediately. That's not the way to deal with acidosis.
I can't even believe that we have to tell people that.
Well, people are scared, and it's just, when you're scared, you're gonna do sometimes inappropriate things. Tonic water. Tonic water is flavored with cinchona root, which is the hydroxychloroquine. But you can actually drink yourself into a dangerous state of electrolytes if you start drinking too much of the tonic water, trying to get the side effect. The 5G tower is a good example. I would say any conspiracy theory right now that tries to pretend that we have any enemy but COVID is going to be wrong. Anything that claims you can cure COVID, like, I'm really looking forward to an immunization. I'm a little concerned about immunization because this is a coronavirus, and coronaviruses, traditionally, we've had some difficulty finding vaccines for. But there's a lot of science being brought to bear with this. I know there's a group in Israel who had a vaccine against coronavirus in poultry. And on the basis of that, I think we can say, yes, it's possible, but it's going to take a while. Anybody who says they have a cure at this point, that's going to have to go through the traditional medicine approach before we can actually say it's a cure or not. Things like our system, things like our app, where we're basically saying, we don't have a cure, we just have a way to improve your basal health so that you can deal better with any stress. I think that approach is appropriate. Better exercise, more sun without breaching the social distancing thing. Just the hand washing, not touching your face. Those are all things that we know help, but nothing at this point will cure.
Yeah, and I guess it comes down to that old saying, if it's too good to be true, it probably is. And I think that's really what people need to think of. If something sounds like it's too good to be true at this point, it probably is. And I think all the things that we're suggesting. I mean, the objective of what I'm doing as well is just simply trying to provide information. When we look at healthcare, we know that education and empowerment is one of those things that always benefits outcomes. And that's really the purpose of what I'm trying to do with this podcast is try to get as much information out to people as possible from as many different professionals as possible, so that people can sort of start to navigate all of this from the right aspect. One last thing that I'd love to get your input on, because I think it's an important thing, is the collateral damage in health. And you and I sort of spoke about this, and maybe there's two things, because I remember there's something else you wanted to touch on. But we are now seeing, like you mentioned, most hospitals right now are really diverting their attention to COVID-19 and those types of patients. But there's a lot of people in there in both of our worlds, like we both sort of deal in the pain management world. There's a lot of people in that world right now that are just being sidelined, right? We have patients that we're not able to see, that we typically see for ongoing type of care. We are able to do some emergency types of procedures, but even that, it's sort of a gray area, right? Because what defines a true emergency? Everybody thinks of a heart attack. Obviously, that's clearly an emergency. But when you're dealing with the musculoskeletal system, you know, a broken bone may be an emergency, but maybe a sprain isn't. But again, it's subjective. Maybe it's an emergency to someone and may not be an emergency to someone else. But I think there's a lot of danger happening in the, not, you know, we're pain sort of guys, and so we can sort of focus there. But sort of with everything else, there's a lot of things, health consequences that are going to play out here that we're not really speaking a lot about, and that maybe people aren't aware about.
Well, you know, it's a big issue. We're not doing the diagnostic procedures. We're not doing the non-urgent, relatively elective stuff that we do to keep us all at a better level of health. Yeah. Our health level, it's degenerating not just because we're not getting enough vitamin D3. Our entire system is focused on dealing with COVID because we at this point don't know what to do system-wide. We know that the stuff that worked 100 years ago works, so that's why we're doing the social distancing, and it is working.
Yeah.
One of the best things that I hope will come out of the things we learn from this pandemic, because there are going to be other pandemics, yep, is how to better deal with information. One of the big reasons why we built this system with IBM, they've got this massive personalized health network. And actually, through the My Pain Sensei side, we're one of the foundational members of that for facilitated self-management, but also to help us use information not just for facilitated self-management, but also so that we coordinate the information better at a systemic level. Because right now we're all over-responding to COVID. We've shut everything down because people are literally dying. And these are the people that we cherish the most, our grandparents and parents the most of all. But there's the possibility of all of us. The more we can learn to deal with information, to share information, to adjudicate information, to make sure that people own their own information individually, because privacy is going to be a big issue coming out of this. The better people own their own information individually, but share their information societally so that we can respond in a more coordinated fashion together to this or to other crises as they develop. I think this is an incredible opportunity for us to learn. You've talked about bringing in some alternative medicine side of things. And yes, that works in this space too, because everybody has something to contribute as long as we're listening, as long as we're respectful while we're listening, as long as we accept the fact that we might be right, but we might also be wrong. Mm-hmm. We need to figure out the best pathway through this together, which is, as a data guy, as someone who uses data to make systems better, this can turn into an incredible opportunity to look after ourselves all better going forward.
Yeah, because we're just collecting, I think, an unprecedented amount of data and even science in this space. I mean, you and I both being evidence-based practitioners, I've never, and I really follow CIDRAP at the University of Minnesota, which is Center for Infectious Disease Research and Policy. And the amount of research coming out right now around COVID, it's amazing, like hundreds of papers all the time, all new, good research being done on all different aspects of this, whether it be treatment, the economic consequences, so many different things. And I think it's true with data. The more data points that we can have, and I mean, I'm by no means an epidemiologist. I did, my 80 hours of stats that I was required to do or whatever. But obviously, the more data we have, the more public health policies that we can make and changes that help guide us. And so I think to some extent, that's maybe a little bit of silver lining there.
Well, it's something, I always tell my students, the only thing that you can the only positive you can make from a mistake is to learn how to do better next time. And if in that situation, if you own that and if you learn from it, that's actually the positive that can come out of all of this suffering that we're all going through. That's why data is so important. That's why we built we're calling it Stay Safe app.
Okay.
And it's just, you can sign up to get on our list. IBM says they'll have it ready for us next week. In the first iteration, the first thing that we're pushing out is just the genomics information so that people can improve their basal health. And then from there, we're going to build it with Health Canada, with the FDA, with our health systems, with our health regulators, so that it actually gives appropriate, actionable advice and helps us all coordinate better in an ongoing fashion, internally and externally.
And that's great. And I think that's a good place that we can, so they can find, my understanding is you can pre-register for the app at thednacompany.com. Is that right?
Yeah, thednacompany.com. You can pre-register there. We're going to be spinning off the mynexthealth.com website from there. And it's just the webmasters can look after all of the trafficking from that point.
Right.
And then IBM is going to be looking after our privacy and security side of things, and we'll make sure that we've got independent science coming in from health organizations and good regulation, because it's all about quality and safety. One of the things I'm most excited about this opportunity is people are very focused on the right things. Like, none of us are going to make a profit from this one. This is one we just have to take this one and deal with it so that we can deal better with everything in the future.
Yeah. And I think, I think that's an amazing thing. We've been trying to do the same thing. There's no money being made right now. Everything that all of us are doing is really trying to help people. And I think it's the right thing to do right now. There's going to be other opportunities to make money. And I really thank any company that is sort of, taking whatever that they can do at this time to sort of help. And there's so many wonderful things. And Dr. David Liepert, I appreciate you being here with us today. I appreciate all the knowledge that you've given us. I appreciate everything that you're doing to really help all of us get through this crisis.
Well, we need to look after each other and we need to look after ourselves. And that we're all on the same side.
All right. Thank you, sir.
Thank you so much. You have a good rest of your day and stay safe.
Thank you. You too.